Hi everyone, it's Memorial Day. Happy Memorial Day. Before I do anything else, I want to talk about some stuff coming up. I hope you're enjoying some of the programming. We have, as per your requests, we have this Netflix series Unorthodox this week. That'll be Tuesday, Wednesday, Thursday, and Friday. It's at 1 o'clock except for Thursday because we're doing another staff parade for you on Thursday at 1. So that day it's 2:30. We also have some of our independent contractors back doing stuff. We've been getting Clint Edwards. He's been doing stuff for us at least once a week. But we have Paul Simeone almost live from his basement. James Michael did a Broadway and the American Songbook concert for us. That's going to be Saturday night. Shelley Adelson from our sales department is doing the Shelley Show at 4 o'clock on Thursday, so tune in. I also started last week Rosary Circle, as per your request, and also on Sundays there will now be a noon Catholic Mass. I was very happy to hear that it went on correctly yesterday, so you will get it. I know it was from the Boston Archdiocese, but the Newark and New York one starts at a weird time and it's live, and I can't hook it up live for you. So I'm still trying to work on that, but in the meantime, you will have a Mass on Sundays. If there is anything you want that we're not showing or not enough or something else you want, please let me know. Again, I know this has gone on for a long time and I'm trying. I feel like we're running out of some stuff, so I'm looking for ideas. One of the things I'm going to start very soon is a sort of virtual book club. We're going to do it a little differently. We're going to read the book in chapters. Me, a couple staff members, and you'll see a notice, I'll put it up if anybody wants to be involved. I haven't worked out how we get you in the discussion, and it may have to be each person gets a question to answer about the book, and I'm not sure. But I know that the first book we're going to do is Kazu Ishiguro's Never Let Me Go, which I know a lot of people have read, but it's a book that I know very well, and so it's easy for me to do that one. And then we can do other things if this, hopefully we don't have to do another one. That's how I should say this, because I'm hoping that this ends very soon, though I'm not sure. On Memorial Day, oh, one more thing. I know that people's mental health was not something that anybody really wants to talk about publicly, but in this case, since you're not in front of me, nobody has to admit anything or say anything. I can. I am noticing a lot of phone calls, and I guess all the staff is, that a lot of you are really kind of getting depressed and lonely. That is not abnormal. You are not alone. This is really tough. Not just for you, but for everybody. And a lot of you are saying when I speak to you and when other staff members speak to you, well, you know, it's worse for me than everyone else. No, it's not. It's just as bad for everyone else in their own way. And it just depends how you're handling it, what kind of social contact you have, how active you are. This isolation is awful for everyone. I've had a few people suggest that we, the staff, don't understand because we get to go home, and I guess maybe you think we're out partying or something, but we're not. We come to work and then we go home. You can ask your family members that trying to get just necessary food and supplies at this point is like an episode of The Hunger Games. food is sold out, so you often then have to go to 2 or 3 places to get stuff. If you want to get it delivered, sometimes it's 4 or 5 days. That's not fun, because I know damn well that these grocery workers have been exposed. I know any store, any retail store employees have been exposed, so that makes us nervous. So we're not living the high life while you're here. But anyway, everybody's feeling isolated, everyone's feeling anxious, in some cases depression. If you already have any of those conditions, then I hope that you are talking to your mental health professional, or at least your healthcare provider. If you're not, and you're self-conscious about it, which a lot of people are, I would hope that you would take advantage of the free counseling that 5 Star is offering you. This is the employee resource program, or hotline, that 5 Star has now paid them to also take calls from residents. It's free, it's confidential. The only thing you have to say is that you're a 5 Star resident. The number is 1-800-327-4692. I hope it comes out correct. 1-800-327-4692. Do not hesitate to call, even if it's just to talk to someone different. And it's okay to say you're not okay. I know that some of you have a tendency, your kids call, your grandkids call, and they say, "How are you?" And you say, "Oh, I'm okay, I'm fine. We're okay here." You don't have to say that. You can tell them, "Well, I'm a little lonely. I'm sick of this isolation. I'm sick of not having programs to go to. I'm sick of not playing cards. I'm sick of..." You can say that, because you know what? They're probably in the very same boat. And I imagine that they're more concerned when you say, "Oh, I'm totally fine," than if you say, "I really just hate this." So take advantage of your family, your friends. If you don't want to bother your family with that, call other residents. And I know we have people calling. I cannot emphasize this enough. Please, just because you're alone doesn't mean you're alone. You can make phone calls. If you have a computer or a phone, smartphone, you can talk to people via Zoom or FaceTime, whatever program you have. Email. Stop watching the news. I know I tell you that all the time, but it's all day COVID, COVID, COVID. That's not helpful. Put on something fun. That's the end of that public service announcement. But please, please get help. Those of you who have seen or go to Regina Minsky's group, she is available privately. I spoke to her the other day. She's also isolated, but she is there and available. I'm going to read the names of people who have served in the military who live in our building. If I have forgotten any of you, it's simply because I don't have you on the list I have. So we 5 Star want to thank all of you for your service and your sacrifices serving our country and us. And thank you for the freedoms that we enjoy at your expense in some cases. Oscar Gohl, Carl Heilbrunn, Ed Lewison, Ron Stackhouse, Tony Lupino, Gene Landsman, Stan Yagoda, Shelley Oren, Scott Peretz, David Loria, Warren Dirksen, Bundy Bonneau, Bob Mensch, Bob Levine, Herb Goldman, Francis Malkowitz, Thomas Gates, Stephen Reithoff, Bernie Deutschman, and Michael Silberstein. Thank you from all of us at 5 Star, and me particularly. I know this isn't a normal Memorial Day. We would be having a big barbecue, though you do have a good menu tonight. But we didn't forget that today is a day to honor you. Thank you. And now first I want to talk about freedom. I am very sick of the Open America, Liberate America protests, people showing up at capitals, people showing up places armed with signs saying ridiculous things like, I need a haircut, or I want to go to a baseball game, or the gym, the people defying the law to go to the gym. This is absolutely ridiculous. And these people are claiming that they are patriots. They are not patriots. I wrote down a couple notes. These people claim that they want freedom of choice. Very funny. That they want to make choices about their own health and safety. But that's actually not really what they're looking for. They're looking for other people to risk their lives for their convenience. That's what it's about. So let's say we open up the baseball stadiums. Oh, great, I can go, and I don't want to wear a mask, and I shouldn't have to. Well, what about the concession workers and the parking attendants, and the cleanup crew, and the ticket takers, and the police? What about you open all the malls, and you open the amusement parks, and all these things, and the public pools? What about the lifeguards? What about I made a list. What about the retail workers and the healthcare workers and restaurant employees, and the hairstylists? I'm going to get to that, the hairstyle thing. I'm very shaggy right now, so are we all. Patriotism sometimes means that you sacrifice what you want for the good of everyone. We particularly self-sacrifice in the face of a national emergency. That's patriotism. I believe in freedom, but I also believe in responsibility. If I have a contagious disease, I believe it is my responsibility to not spread that to other citizens. If there is a potential for me to injure someone else by some action, I think I have a responsibility to not do that. These people that are out protesting Open America, Liberate America, these are the very same ones who complain about taxes. They don't want to pay taxes. They are involved in conspiracy theories. They want the government out of our lives, except they also want the government in a woman's most personal decision about her own body. So the government should control my body, but not yours. The government should make healthcare decisions for me, but not for you. That's what this is. And what they're really advocating is, in effect, a freedom to die. They don't believe in gun control, though more people have died from gun shots, bullets, than COVID has killed. They don't believe in seatbelt laws. They don't believe in speed limits. What else don't they believe in? They don't believe in universal health care. So if you don't have health insurance, you're just going to die. They don't believe in any government assistance for food stamps or rental assistance for poor people, particularly children. So if a child's family doesn't have money, they should just starve and die. That's the freedom they're advocating. That's not patriotism. And they don't see the hypocrisy in it. And I always believe that this is really a racial thing, because they all ran and took their $1,200 stimulus checks. You didn't see any of them protesting that, yet every year we see them protesting on tax day all around the states that they shouldn't have paid taxes, but they then shouldn't have taken those checks. They should have returned them because they disagree. But did they? No, they did not. So, and they are all white, by the way. So it's not about not wanting government assistance. It's about not wanting government assistance for other people, for them, And who are them? Anyone who's not white. Anyone who's not Christian. Apparently they read a different book than I did. Maybe, again, I've said it before, maybe I went to a really liberal school, but we were taught to share the wealth and to give unto others, not to be selfish. We were not taught to hate people of different colors, different religions, different ethnicities. That's not what I was taught in Catholic Christian school. So I'm not sure where these people went to school or where they learned their theology or their religion, but it certainly was not where I went. The other thing I want to talk about today, I was going to talk initially, follow up from last week on the disastrous cabinet departments, but you know, I've been watching the current occupant of the White House for a couple days go on and on about opening America, and he's supporting these protesters. He's also talking about the voter fraud that is non-existent, and putting up these warning signs about vote by mail, where suddenly this is going to be some huge fraud. We've seen no evidence of that in the states that have it, Republican or Democratic states. I think there's 6, let's see, Washington, Oregon, Utah, Colorado, Wisconsin, Nebraska, Kansas, North Dakota. A whole bunch of states have vote by mail or vote by mail options, and nowhere is there a vote by mail fraud situation in any of those states. And the only place where there's been a consistent vote mail fraud, I don't even really like to call mail fraud, but it's absentee ballot fraud, has been Miami. There was a congressional race, a mayoral race, and I think the third one was a city council race where people had tampered with the absentee ballots. It was the same politician involved in 2 of the 3 of them. So that was a problem with that person, and it was a problem with the way that the absentee ballots were being brought in and processed. And there was definitely fraud there. That's very different than a vote by mail when it's universal. And there's all this talk that dead people are gonna vote and things like that. That's not happened anywhere where vote by mail has been instituted. So this is another made up problem to divert the attention of America from the failure of this administration to control this pandemic. That's all it is. The National Councils on State Legislatures support vote by mail. The state secretaries of state, other than the nut in Kansas, support it. It actually eliminates fraud in a lot of ways because it's one ballot and you're checking immediately. Now, the thing is, you're not going to get results from a lot of places immediately. There will be a delay. But in this case, states are looking at it for this year, the responsible states, because we do believe there will be a second surge of this virus based on the states that haven't closed down completely and the fact that we still don't have testing available nationally. And that's the way it happens with pandemics, because China has a mini surge happening again right now since they've somewhat opened up. But what I really want to go through is I want to go through the timeline of this virus in America. And I know we've heard it before, but I started looking at it the other day because I heard the occupant of the White House say that 100% testing will be available next week. And I thought, my God, we've been hearing that for a very long time. And so I went on various news sites, I never rely on one, and I started looking at just how long have they been saying this. And I also looked at how just the last administration, I didn't even go into the 68 pandemic or the 1950s pandemic. One was Asian flu, and the other was one of the influenzas. I just looked at what the Obama administration had done, and I don't think they're perfect at all, but I looked at the swine flu and the Ebola crisis, and I'm going to compare them. So I'm going to start with, now, President Obama had just taken office in January of 2009. We had the first case of swine flu in April. The Secretary of Health and Human Services, Kathleen Sebelius, had not actually even been approved yet by the Senate. Now, they believe that swine flu, that strain of swine flu, came from Mexico. Just so you know, when all said and done, in America, we had 60 million cases of swine flu of varying degrees, obviously. 274,000 hospitalizations, 12,500 deaths. Now, why? Was that less deadly than COVID? Yes and no. 60 million exposures, most people just got better by themselves. There was a vaccine out there already, which helped. But why did that not spread so dramatically? And why was it such a narrow spread? Why? The first case was diagnosed in America on April 9th. By the 22nd of April, help me do math here. 13 days after the very first case was identified as swine flu, the CDC's rapid response team was out in the areas where it was. They were distributing materials to healthcare workers. They were getting vaccines and producing the vaccines. By April 26th, the Health and Human Services acting declared a national emergency, which allowed the national stockpile to be used for healthcare workers. The first death was April 27th. So now understand this, prior to the first death, the CDC was already being allowed to do what they knew to do in an infectious disease situation. There was no interference. Now, you might all remember the picture of President Obama getting the vaccination for the swine flu, with the nurses having masks around him. I'm not sure if he had a mask on during that day. I didn't look it up. By May 6th, all states had tests. So, less than 1 month, the CDC, with the White House and Homeland Security, had made sure that all states had tests. So though people contracted the disease, and there were schools that closed in high infectious areas for short times, there was never a problem with getting hospitals and healthcare workers the information or the materials that they needed to fight that virus. Now, because of the vaccine that was available, people were getting the vaccine, so even if they had an exposure, it was minimized and people didn't die because of the vaccine. Now, in this case, we don't have a vaccine for this yet. We know that because it's a new virus. But you didn't have the president and his cronies on TV every night saying, oh, testing is available. Oh, no, it's not. I'm going to get to that, though. So science was ruling the day on that, not politicians. And that is why, though we had a massive outbreak of swine flu, we didn't have all the deaths. All the information coming from Washington to healthcare was consistent and accurate and based on science. Now, the second little epidemic we had, which didn't turn into one, was in 2014, and that was the Ebola disease that was widespread in West Africa. With Ebola, we had a total of 11 cases and only 2 deaths in America. The first U.S. case was September 30th, 2014. By October 19th, so September 30th, excuse me. So I can't remember if September has 31 days. Let's say 20 days. Within 20 days, the CDC was contact tracing. They had their rapid response team out. They were airport screening. At any airports where people were coming in from West Africa, there was a travel ban immediately. I think the travel ban was issued on October 1st or 2nd. Anybody who was coming from those countries or had exposure to anyone from those countries had a 20-day mandatory quarantine. Now that included New York, Connecticut, New Jersey. Chris Christie was governor, by the way. Illinois, Florida, Rick Scott was governor. Pennsylvania, Maryland, Georgia, Virginia, California, Maine, and Texas, where Rick Perry was governor. So we ended up with very few cases and only 2 deaths. Because there was no delay. We shut down, and we were in contact with the West African governments of the countries that had this, and they were shutting down travel, both in and out. So it didn't spread worldwide like we thought it might, if you remember. And everything was under control. And again, science led the day. That's the difference. We had cooperation with Europe and with Africa and with Asia. Everybody was cooperating. Here's where it started. Here's where it was. We're going to isolate that and make sure it doesn't come to us. And Europe got away on that also. We weren't sending different signals to different countries like has been going on now. And we dodged a bullet. We ended up sending West Africa help, so did Europe, so did Asia, China, to stem that disease. Now, what's happened here with COVID? People focus on, or the media, the legitimate media, focus on the time period from end of January through now, pointing to the failures of this administration. I don't want to focus on that time period specifically. I want to talk about beforehand. I want to talk about how we went from not doing anything to prevent this to 1.6 million cases in America and 98,000 deaths and rising. Let's go back to November of 2019. And I know people want to go back earlier and talk about the pandemic office and the pandemic plan they threw away. You know, that doesn't surprise me at all, but I want to talk about what this administration absolutely knew and when they knew it. November of 2019, we have a U.S. National Center for Medical Intelligence warned this administration that there was a new contagion spreading through China and warned that this could be a pandemic. Now, this is November of 2019. December 10th and 30th, those are the, in between that, those 20 days, China's cases had risen. It was a respiratory disease. And they realized that this was a new novel coronavirus. Now, the administration knew this. January 3rd, the CDC was in contact, our CDC, with the Chinese CDC, talking about the potential for an international crisis. This is January 3rd. Now, it's still 2 months after our medical intelligence unit told this administration that there was a potential for an international pandemic. starting in China. So 2 months later, no, January 7th, January 8th, Chinese identify it as a coronavirus. CDC alerts doctors and hospitals. They warn American hospitals and doctors about a respiratory disease, and they put them on alert for it. Mid-January, we have the first 2 cases in Chicago and Seattle. Now, Chicago was one woman, she was a nurse who came back from Wuhan. In Seattle, this is the case they should have looked at and should have really paid attention to, because one man came back he had been in China in December, came back, he was just living his life, had a cold, didn't worry about it. He had it. He's the second person to be diagnosed. He infected, through contact tracing, they've estimated that he infected about 230 people in I think they said 6 days. So that was January 15th. January 15th. You have one person with a disease that infects that many people that quickly, and nothing was done. January 16th, because of what was happening in China, Germany produces the first test for the coronavirus, now at this point called COVID. The World Health Organization distributes that and how to make it across the world. Everyone's using that test except who? The US. This is when the nonsense begins. So by the 15th of January, we figured out that one person can quickly infect 230 people. The CDC starts screening people at airports on January 17th, but not all airports. San Francisco, New York, LA, Atlanta, and Chicago. Not Seattle, not Newark, not Boston, not Philadelphia, just those. The president says we're in great shape. The president starts praising China, and he praises China from January 17th on till February 7th, I believe. Where's my other note? I think it's February 7th when he then calls it the China virus. I want to make sure I'm not wrong. January 30th, the World Health Organization declares an international emergency. We do nothing. The U.S. does nothing. The president says that the virus will be over by April. Remember that? The same day he said that, which is February 10th, he's proposed a budget that cuts CDC $110 million. February 14th, National Security Council says the U.S. government response to the 2019 novel coronavirus outlines a potential federal social distancing response. This is what the National Security Council recommended, that the federal government limit public gatherings and cancel almost all sporting events, performances, public and private meetings that cannot be convened by phone. The memo also contemplates school closures and widespread stay-at-home directives from public and private organizations, with nearly 100% telework for some. That is February 14th, coming from the National Security Council. Where are they getting their information? From CDC and the Office of U.S. Medical Intelligence. So this is not the World Health Organization, which you've heard the president's blaming everything for. This is coming from our own office, our own intelligence, and yet it's ignored. This goes on and on and on. I'm not going to go through every day. I circled a few things. The president, trade advisor, Peter Navarro, sends a memo saying there's an increasing probability of a full-blown COVID pandemic that could affect as many as 100 million Americans, with a loss of life of as many as 1.2 million. The president says everything was under control. February 25th, this administration said, we've contained it. I won't say airtight, but it's pretty close to containment. The Trump campaign spokesperson, who's now the press secretary on the same day, Kayleigh McEnany, I don't know how to pronounce her last name, says, we're not going to see diseases like coronavirus coming here. And isn't it refreshing when contrasting it with the awful presidency of President Obama? I don't know what that means. Trump, on February 26th, then replaces Health and Human Services Secretary Azar, with Mike Pence being in charge of the coronavirus. Now, the deaths start in March. First death is February 29th, which is March. The administration said the American public needs to go on with their normal lives. I encourage them to go about their life. That includes travel to California, Oregon, and the state of Washington. Meanwhile, the mayor of New York was telling people to get out of town. March 3rd, at that point, there are only 9 people dead in America. I don't mean only, but the president says that it is not inevitable that the coronavirus will spread across America. The Health and Human Services Director says, for the average American, the risk of getting coronavirus is very low. The administration claims there are no limits on testing other than a doctor's order. Meanwhile, no tests were being sent out. On March 4th, 11 people were dead. The current occupant of the White House told Sean Hannity, we have hundreds of thousands of people who get better just by sitting around and even going to work. Some of them go to work, but they get better. He thinks 3 to 4% death rate is really a false number. The next day, he says, I never said people that are feeling sick should go to work. This is more fake news. Yeah. This goes on and on. Meanwhile, we know there was a breakout in nursing homes and senior living communities. Nursing homes, which are federally and state funded, did not have the personal protective equipment that they needed and kept begging for it from January on. The first protective equipment shipment to a nursing home from Health and Human Services was May 7th. 5 months after requested. 5 months. Now, every single week, if you go through my whole timeline, you see them saying everything is fine and testing is available for everyone. It hasn't been, it still isn't. And now we have 98,000 Americans dead and climbing. Where are the new cases? North Carolina, Tennessee, Wisconsin, Alabama, South Carolina, Nevada, Oklahoma, Arkansas, Maine, West Virginia, Puerto Rico, and North Dakota. Why? Because these are states that didn't lock down, don't have tests or equipment, and have listened to the White House. Where is it decreasing? New York, New Jersey, Massachusetts, Pennsylvania, Connecticut, Colorado, Rhode Island, DC, Oregon. What do these things have in common? Democratic governors who did not follow the administration lead. This is yet another reason to not vote to re-elect. It is not the president's fault that we have a virus in America. What is the president's fault is the second wave that is about to happen in America. Why is it going to happen? Because all these states opening prematurely with no restrictions, listening to the freedom protesters. Missouri reopened. They had never been fully locked down, but they reopened against the advice of everyone except for the White House. By the way, they were on the list of states that were decreasing. Well, now over the weekend, we see a Great Clips, which is like a Supercuts chain. 2 hairstylists had COVID, exposed at least 140 people, plus whoever else they were in contact with outside of the hair salon. All right, so think about that. If they went to a store, if they went to the pharmacy, if they got their hair cut somewhere else, if they went to a movie, wherever they went, whatever home, if they went to church, but it's a minimum of 140 people. That is how quickly this spreads. This is why this should have been a national lockdown, coordinated from CDC, not from a political office in the White House, because that's why you're going to see a second surge. You have all these states that are opening prematurely, that haven't tested. The states that have been hit haven't tested enough. The states that haven't been hit don't even have testing. And I'm going to keep saying that to you. Don't listen to them on TV. Don't listen to the White House. They don't have tests. Republican governors are saying it, not me. Don't believe me. Look up what the Republican governors are saying. So they're opening based on their numbers of hospitalizations and deaths that they can track to COVID. But you can't open without adequate testing. That's why even New York and New Jersey, our opening right now is very limited. And it was really scary to see people on those beaches yesterday. I think that's insane. But we'll see. We'll see what'll happen with us. Though I have confidence that our governors will shut down again immediately. And they're still not opening everything, and it's a phase in, phase out. These other states, let me go back. We've also had testing that is statistically representative. Now, that doesn't mean we have enough testing of the population in general. We haven't. But when you look at where the COVID cases were and where they were growing hospitalizations and deaths, those areas have been tested at a statistical number enough that you can estimate how many, and that's why you can lower. Now, I know some of you don't like statistics, but it is accurate when it comes to these things. So that's why there's talk in New York and New Jersey about opening regions, because there are certain regions that have not been hit. It's why the shore towns in New Jersey are in conflict. Because they haven't been hit very hard. Because of course it was winter when it started, so you don't have people outside the area coming in. If you open up regular tourists for the Jersey Shore, you're bringing anybody up here, Pennsylvania, New York, into Ocean County in the shore towns, and you could have an epidemic. And that's why the towns are not allowing rentals, and they're doing all these things, which is really going to hurt them economically. But in the long run, having a portion of your population dead, and the healthcare costs are far more substantial than a loss of a bad summer. You also have in the shore towns, year-round residents are substantially older than the population in the summer. And as we know, seniors are the most vulnerable for this disease. So even this weekend, Memorial Day, they allowed the beaches open, but nobody could swim, which it was cold. I mean, I wouldn't go to the beach this weekend. But a lot of towns down the shore limited beach going to local residents. And that was to keep people out who could potentially infect. So that's the challenge. New York, New Jersey, we have a summer tourist economic challenge ahead of us. The other states who are just seeing a rise in this have a larger issue politically and health-wise. They do not have the healthcare accessibility that we have. They don't have the expertise that we have. I mean, there are states that outside the city, there might be one hospital. You're going to see a huge surge in death. Now, the other thing that's happening is South America. This administration cut off travel from China and Asia early on. And in retrospect, that was fine. But again, we should have coordinated that, because we now know that New York and New Jersey, us and Connecticut and Massachusetts, the East Coast, the strain of corona that we got came from Europe. So then we limited travel to Europe. But we haven't cut off South America. So pay attention, because, I mean, Brazil is dying, plus the other South American countries. So pay attention, because you're now going to see probable increases in Florida, Louisiana again, Texas, who am I forgetting? Mississippi, because it's tourist and business trade. But we only cut off travel just to Brazil yesterday. Now, there's no way they can possibly say that they didn't know Brazil's cases were rising, because I knew it. It's been on the nightly news. You can just go to the New York Times. The New York Times website has a daily update, worldwide and US. And you could look over the past 3 weeks at the countries that it's rising in, as well as the states. Brazil's been up there for 2 weeks, so we just decided yesterday to cut off travel to Brazil. Does nobody at the White House actually read the paper? I mean, and those numbers are all coming from CDC and WHO and NIH. So this isn't like the New York Times is investigating this, they're just reporting it. And the numbers are the very same in the Wall Street Journal and other newspapers. These are not fake numbers. And so instead of dealing with all this, what we have is the current occupant of the White House, once again, making up a problem